Good morning, friends. Welcome to Conceptual Surgery. I am Dr. Naufal Nahas, and from today we are going to start this series of MCQ discussion. So, before the student attempts these MCQ series, I think the resident should be knowing the importance of MCQs. So, to know the importance of MCQs, they should also know a brief history how MCQs came into Indian education of medical sciences. So today we have with us Professor Arun Kakar sir, who was there with the NBE board, who started MCQ question making from quite long ago, and it's still continuing to give multiple MCQ exams for various residency programs. So I welcome you, sir, on board. So, sir, what was your history and contact with NBE while you prepared MCQ questions for them?
Thank you, Dr. Naufal. Halstead was the one who started the American board in America, and Halstead was possibly the first one amongst the educationists who introduced shorter forms of evaluation other than the long essay type questions as were prevalent in the history of evaluation technology and in the history of teaching the postgraduates. But it came in a big way in 50s, and English surgeons and the Royal College of Surgeons and Canadian School of Medicine actually propagated MCQs in surgery. In India, National Board was possibly the first institution that introduced MCQs. And to the best of my knowledge, somewhere in 86, later half of 86, December or so, for an examination to be conducted in January, they collected a couple of people to prepare a first paper consisting of, I think, 120 MCQs in National Board of Examination, especially the part 1 or the theory part of it. And I was fortunate that I was one of those group, and I had doyens like Dr. Inder Dhawan, who is no more, unfortunately, sad for everyone, one of the excellent teachers who had a thorough knowledge of basic sciences, the knowledge of surgery, who was a very good orator, Professor S.K. Nair, Hallis Award winner from Royal College of Surgeons, and myself, the junior most amongst the three. We were told, this was a month of December 1986, and we three were put up in a room, and our then executive director of National Board of Examination, Dr. Manny, one of the very gentle, very friendly, motherly lady, who said, I'm going to put the three of you in a room, I'm going to lock the room, and you will not leave the room till you complete this quota of, I think it was about 60 questions or 80 questions. Of the remaining 40 questions were to be contributed by orthopedic group, the physiology group, and the other specialties. And it was almost 9 o'clock at night that we finished 125 questions. One of the silver lining was you would not leave the room. You would be provided whatever you want, But you can, and that's how the MCQs was
MCQs started.
introduced in National Board of Examination. That's a little bit about history, and after that, number of workshops have been conducted by National Board. And over a period of time, we realized that single response type, that is 1 out of 4 or 1 out of 5, was not an ideal method of evaluating a candidate. So we introduced other types of MCQs like matching type, true false type, reason assertion type, and multiple choice types. What is the role of MCQ from a candidate point of view? The society has changed, the values have changed, and everybody wants to achieve the maximum in the shortest possible time. And same as the expectation of a resident. MCQs are good for revision. Let me tell you, MCQ is not a replacement or is not a method of achieving a knowledge. You can recall few subjects, topics, keep it in your mind, and given the circumstances, you may recall which would be the best response. When it comes to other type of MCQs like reason assertion or true false type or even single response type, if they are problem based, they are difficult to construct and they really test the skill and the knowledge of a postgraduate. I can understand that when a postgraduate starts a course, 3 years course in National Board, or as a MS candidate, the primary aim of the candidate is to clear that exam in the first go with flying colors. And there's no way better than mastering in an MCQ.
Yeah.
I fully agree with you, but I also want to not warn you, but prepare you that by mastering an MCQ, you will pass an exam, definitely. You may get a skill how to make quick decisions, but will you acquire a knowledge? That's a big question. Because to acquire a knowledge, you need to do a lateral thinking. For MCQs, the answer is in those choices, 1 out of 4 or 1 out of 5. So you don't have to do a lateral thinking. That's a big drawback of MCQ. But I fully agree with you that since your first priority is to clear an examination, you would like to master the art of clearing or mastering the analysis of MCQs. I would suggest that in addition to reading or no replacement to that, reading every day, whatever you see, whatever problems you face, MCQs can be used for rehearsal or for quick revision of what you have learnt over a period of 6 months or 1 year or 3 years. And it is expected and it is a part and parcel of National Board examination, and I believe in some of the universities in MS exam also there is an MCQ. And it's good to And in fact, it is expected, and you should be practicing the MCQ cracking. But I again repeat, you would be able to crack the paper, but you won't develop any surgical skills. You will not have a knowledge. The knowledge would be superficial. And whatever we in conceptual surgery are trying to do is A, to prepare you how to crack that MCQ paper, how to revise your knowledge, and if time permits, maybe we'll have problem-based MCQs.
Yes.
So that they can help you in solving the clinical scenarios in your future endeavors, in your growth, and when you are in our place as teacher in propagating and transmitting that knowledge and information to the younger generation. What do you say, Dr. Naufal?
So, what Sir was trying to convey is the importance of MCQs. So, the residents should know why they have to be in touch with MCQs. As Sir told, MCQs are not a complete, proper evaluation of the student's knowledge of the subject, but definitely it is an easy tool for the examiners to qualify these students for higher studies. And one more thing is, like, if the students are planning to go for a exam abroad, if they want to settle somewhere abroad, the systems over there also use MCQs as a tool to assess the knowledge of the students. Like Sir has already told, that it is not a complete assessment, because they have the options of giving you 4 or 5 answers, and from that you have to choose. But it is the technique that you have to learn to how to approach these MCQs, and from whatever minimum knowledge they have given in that particular question, pick out the maximum number of points and come to a conclusion. So, like Sir has already told, if you go through these various textbooks, after they have the theory discussion that is given, they have these MCQ questions that are given for the students to just go through it, and so that they can revise it. So it is a very good tool for self evaluation of the student. So in conceptual surgery, what we are trying to do is, we have given you all the theory lectures, we have given you the theory notes, and even the examination part, we have already given it to you through the app. So what we are trying to do is, we are adding this extra feather to the conceptual surgery app by Dr. Amrit Nasa, who's already into MCQ discussions for the UG students as well as the postgraduate students. He'll be coming to you, and he'll be giving you multiple sets of MCQs so that you can solve them. You can also understand at what level you are at in your learning through your residency, and also you can be prepared for these competitive exams that are going to come later on in life. Let it be for your super specialty, let it be for your exams abroad, even for FRCS courses or an MRCS courses. The way of assessment is MCQs. So MCQs can't be just taken away from you. You can't just say that you have entered post graduation and now no more MCQs. But definitely it is going to be there, because it is the easiest tool for an examiner to assess a student. So I think MCQs should be kept in mind. So I hope this particular course, which Dr. Amrit Nasa, in association with conceptual surgery, what he's going to do is going to benefit the residents of surgery, sir.
Absolutely right. My only advice to you is that the MCQs which you face when you are appearing in America or in England, they are generally problem-based MCQs.
Yes.
They are not one of the best types, the commonest causes, or the sizes, or the vital
Percentages.
capacity is 1, 2, 3, 4. They don't ask you like that. They give you a clinical scenario, and after reading that clinical scenario, based on that clinical scenario, they frame MCQs, and they want to test how much what you have learned can you apply in clinical situation. At the same time, I would request you, young fellows, to give your feedback. Which way can we improve in presenting, formulating, and improving the MCQs for you to help you in passing your examination, not only India, but abroad also.
So hope the conceptual surgery app will be able to do justice for the residents, and hope the residents also will use the conceptual surgery app properly so that they can clear all these competitive exams in their future. So all the very best students from me and sir, and hope this conceptual surgery program is going to benefit you to the maximum. Thank you. Thank you, sir, for your interaction with the students.
It's a pleasure and wishing you all the best.